Good morning, and thank you for having me. I'm going to take you on a journey to the center of Ari's brain. Ari was a 2-year-old kid when I first met him about 3 years ago. And you see he's a bit upset because he developed this brain tumor, a very large, complex one. He developed this brain tumor and he developed an epileptic seizure. He was admitted to a hospital in San Francisco. This tumor had been growing inside his head. And at first they did a small hole, put a tube in, get a biopsy, drain some of the fluid, make him better. The diagnosis came as something called craniopharyngioma. This is a rare type of tumor. It's actually not strictly a cancerous tumor, but it's an invasive tumor that grows in the base of the brain towards the center of the brain. And it can be a really devastating problem. The family at that point, instead of being devastated, they just embrace the reality and start reaching out to multiple centers worldwide, 20 centers in particular, trying to solve the problem. What was the best option for him? Of all those centers, about a third of them said, well, I think it's best that you don't do anything for now, because this is very risky. He's a bit better. Let's see how it goes. And that's what they did at first. But that didn't last long. One of the cysts on the tumor continued growing, and he started his vision got worse. Another third of centers said, well, radiotherapy is an option. Why don't you try radiotherapy? But radiotherapy in a 2-year-old child is very aggressive, a lot of potential side effects, and it's not very effective for something like this. So that was ruled out as an option. The other third of centers or experts said, well, you need an operation. But an operation for this tumor is, very risky and not as effective because the tumor is so big, heavily calcified, deep into the center of the brain. You look at this, simulation right here. This tumor is surrounded by all those vascular structures, and it really is very difficult to get access to this tumor. Traditional approaches and what he was recommended was going from the top of the brain, where you basically split the center of the brain, what is called the corpus callosum. You go into the ventricular system, and from there, through the center of the brain, you go into the tumor. An operation done for decades, but again, with not very good results. Very high risk of what is called hypothalamic injury. The hypothalamus is at the center of the brain, and it controls a lot of daily activities like eating, sleeping, just being aware, being awake, so basic functions. So at the same time, I had been recruited by Stanford, this is 2018, to run the skull-based and brain tumor program because of my expertise doing skull-based tumors, and in particular through an innovative approach, which is called the endoscopic endonasal approach. This is a type of operation we do through the nose to get to the base of the skull. Some would say it's nothing new. The Egyptians already, emptied the contents of the head of the brain through the nose, but this is now in vivo and for real. And we use the sinuses, which are, aerated cavities inside the nose that give us access directly to the base of the skull. And we can access tumor this way. It looks almost like cheating. You go to the base of the brain, to where the tumor is arising from, and you can actually remove the tumor from that area without having to touch anything around. You don't have to touch the brain or the optic nerves or the vessels around it. So I was part of the pioneering group. I worked with them for over a decade, and that's why I developed this expertise. We contributed to the advancement of this technique. And I had done this many times, these craniopharyngiomas through the nose for many patients, especially adults, some children too, but never in a 2-year-old kid. Had never been done before. The problem in 2-year-old kids, in children, is that the sinuses are not aerated. It's like a block of bone, and the passages are extremely narrow, so really difficult. So what we did is I told the family, yes, I think we can do it, but let me study it a little bit better. So we went to my laboratory, and we did these virtual reality simulations you see here. This is going through the nasal cavity and trying to explore the passage all the way to the tumor, which is that thing in green you see there. A lot of bone to go through, but you can get to the tumor. And most importantly, we did this 3D printed model. This is a real replica of Ari's head. And my lab is like a laboratory, it's like an OR, has all the equipment to rehearse an operation. So we did this carving of, like carving a marble block at the base of the skull to get all the way to that green thing, which is the replication of the tumor. So we rehearsed, we prepared, we thought we were ready for it. The family was on board with us. Again, this had never been done before. I'd done many tumors, but none of them as challenging and such a young child. But we did everything to get ready for it, and we showed it. So this is the real operation. So you see, going to the small nasal cavity. I'm going to show you in 1 minute a 12-hour operation. So this is just the highlights. And then you see with that high-speed drill, we are carving all that bone to finally expose the base of the skull. You can see the lining of the brain right there. And we are opening it, and we are getting into the tumor. And the beauty of this, I can get into the tumor without touching any brain. Those things you see there are the optic nerves. You see part of the brain. And we are going inside towards the center of the brain. And those are key vessels that you see there. And those white structures, those are the mammillary bodies, key of the memory circuit. So we're just literally detaching this tumor from that center of the hypothalamus, center of the brain. And we do it with an excellent visualization, 4K definition, great detail. Everything was going great. We were excited. But at some point, we had some problems in the operation. We started seeing some bleeding right there. Those important arteries, there is bleeding from that artery. This is a critical situation where you have high flow arterial bleeding, shooting blood into the center of the brain. I use this bipolar coagulation trying to seal it, but I can't. It's not effective. So we brought this instrument, which is called an aneurysm clip. It's just a clip that you put with a long shaft instrument, and you are trying to just sidewall clip that opening to stop the bleeder. And we did so. The clip went just in the right spot. I had never done this before either, putting a clip like this to the nose like that. But I went right on the spot, stopped the bleeding. The artery remained open, so no stroke would develop. And then we finished the operation, remove the last bits of tumor, and we reconstruct, close the opening, and we finished. So this was, it was a real challenge. Thank you. Yeah, we felt like that. We felt really relieved. And actually this was highlighted in the media and in NBC News. That's Eamon Moholdin, who is a colleague. And the funny thing is that how media is, that they highlight what they want to highlight. This is 3D virtual reality and printing what saved the life of a child, instead of saying when it's the years of hard work, dedication, commitment to training, and developing the surgical skills, which is actually what it is. And that's the message I want to send to you, that it is actually surgery and innovation in surgery and research in surgery has a lot to do and to offer to the treatment of patients with brain tumors. This is Ari, 3 years later, doing really well. Thank you so much.